Hi, I'm Dr. James Nill of Nill Family Chiropractic and Wellness Center. Today we're going to talk about knee pain. Now, the first thing we're going to do is figure out what the cause and diagnosis is of the knee pain. And there are several things I see usually every day in my clinic. One of them is knee sprains or strain. A strain is if a muscle gets pulled, and a sprain is if your ligament has a problem. And I'll show you how I can diagnose between the two in a little bit. Another thing could be arthritis in the knee from wear and tear, and that is usually caused by having flat feet or maybe a short leg, which I can actually help diagnose that too and treat it. Another thing could be a patellar displacement. The patella is dysfunction, which is a kneecap, and that actually displaces out of the way, which causes instability within the knee, and we can actually fix that. Now, the first thing we want to do to diagnose the problem is find out how the ligaments and also the meniscus, which is the in between the joints in here, are doing. So we're going to test the posterior lateral ligament, or posterior cruciate ligament, anterior cruciate ligament, medial collateral, lateral collateral, and we also want to listen for clicks in here to see if we have any meniscus problems. Then we can also test for patellar deficiency. Go ahead and strengthen that right there. Good. And let it go. So now I can actually come in here and actually find out where the displacement is. Now, after we know that the ligaments are okay, the meniscus is fine, we also want to come in here and test and see where the knee's having problems. And I can feel there's a weakness on the medial side and a tightness on the outside. So what we want to do to treat that is we can actually move the patella where it needs to be and get in there. And unfortunately, this is not an easy process, and he could tell you that it hurts a little bit sometimes. But his knees aren't really that bad. We're just kind of showing you right now. So we turn muscles on using what's called origin insertion therapy. So I work above the knee, all the way up, and below the knee, the different muscles that help stabilize it. We also want to come behind and underneath and down here in these muscles in the ankles. So what we're trying to do is stabilize that. Then what we're going to do is actually turn the foot out in whatever position we need to wake up and strengthen these muscles. So he has a medial problem, so we're going to turn the foot out. Go ahead and straighten your knee out, and then slowly go down, and then go up again, slowly go down. So what I'm going to do is keep turning this on, up, down, and we're going to actually help stabilize this kneecap. And then by doing so, once you get the kneecap stabilized, it'll help strengthen the knee and take the pain away. When we're done with that, sometimes I like to come in here and actually do some joint manipulation and then move it around and then put it back where I need to.